No one sat us down and said, this is how health insurance works. This is what a doctor's appointment checkup looks like. This is when you go to the ER versus urgent care versus Google it. So that's what I'm gonna do for you today. I'm gonna be that person who explains all of the nitty-gritty about owning your own healthcare in your 20s. I'm Dr. T. Let's get this started. So here's the thing about healthcare in your 20s. A lot of the time you're going to feel pretty good. You might have a few issues here and there. Maybe you want to talk to someone about some sadness or depression or maybe contraception, but most of the time you feel like you don't really need a doctor. But as doctors, we're not just here when you feel bad. We're here for you when you feel good too, or when you have questions. So even if you feel great, this video is for you. So first things first, do you know if you have health insurance? If you're under 26, it's possible that you are under your parents' plan still. That's the law in the United States, but even if you don't have healthcare insurance, you can get it other places, like through your employer or through healthcare.gov. That's called marketplace insurance, which actually has something called income-based subsidies, which makes it more affordable for people who don't make as much money, or you might even qualify for Medicaid. So, healthcare.gov. And then here's some language that you should know. First of all, deductible. That's a term that's used to describe the money that you have to pay before insurance kicks in. We call that out of pocket. Your copay is the flat fee that you pay per visit, and your out of pocket maximum is the absolute most you'll ever have to pay in a year. And then insurance kicks in and covers everything 100%. So know these numbers, and if you have any questions, your insurance card should have a number on the back of it that you can call and get those answers. And once you know you have health insurance, you should use it. So let's talk about what a checkup looks like. If you're going in for an annual visit or an annual wellness with your provider, so that could be a family medicine physician, that could be a gynecologist. When you get older, it might be internal medicine, but a variety of providers can give you a wellness exam. That includes doctors, nurse practitioners. So going in for that wellness exam is going to be covered by insurance. And typically there's not going to be a cost associated with it, generally no copay, because it's preventive. So we're preventing anything bad from happening to you, which would cost insurance companies more. So you don't usually have to pay for it. So it's usually free. So when you go in for that wellness exam, things that they're going to do, they're going to do some vital signs. So check your blood pressure, your heart rate, maybe your oxygen. They'll probably get a weight and a height on you. And just also know that if you're uncomfortable with weight, you have a right to decline that too. Just talk to your provider. And then they may order some blood work. So depending on how old you are or your risk factors, things that they would likely include would be if you're sexually active, an STI check. So gonorrhea, chlamydia, which is a vaginal swab, HIV, syphilis, which are going to be blood tests, and then potentially diabetes. So if there's a family risk or if you have some risk factors, then might check and see if diabetes labs are all in order. And then cholesterol panel as well is something that we recommend at least once for young folks to get. And then any other symptoms or concerns you might have, or any family history that you might have, like thyroid disease, those would be reasons to check other lab work as well. And then the other thing that they should do at every wellness visit is ask about your mental health. So do a screening for depression, anxiety, and make sure you're getting all the support you need for managing your mental health. And this is an important point. Mental health is your health. That is your wellness. And so if there's anything that is bothering you, this is the time to bring it up. You don't have to be in crisis and wait until things are really bad to seek care. Address it at your wellness visit and make sure that we prevent things from getting worse. Now, if you're 21 or over and you are sexually active, this is likely when you will also be getting a pap smear, which is the exam where you sit with your legs spread in the chair, and then the doctor uses a speculum to find your cervix. So you look in through the vagina, find the opening to your uterus, and they take a sample. And they do that to check for signs of HPV, which can lead to cervical cancer. So a really important screening that does reduce your risk of cancer long-term significantly. Talk to your doctor if you have concerns. There are ways to calm your nerves down before it can be a nerve-wracking exam. So just be open with your doctor. And along those lines, that's a good time to talk about your period as well. So if things are irregular, if they're super painful, if you are having any other symptoms, mood changes around your period that are bothering you, skin changes, stuff like that. This is also the time that you bring those up. Again, to recap, your primary care provider is for when things are well, and for follow-up of things that don't typically need urgent attention. Urgent care is for things that are not emergent, so you have some burning when you pee, like a UTI, strep throat, or a yeast infection, or if you have a mild cut or burn or something like that, those would be reasons to go to an urgent care versus an emergency room, so an ER or an ED, emergency department. Those are going to be things that are a true emergency. If you are unable to keep fluids down, if you feel like you're dehydrated, if you're having any severe symptoms, severe abdominal pain, severe leg pain, chest pain, trouble breathing, trauma, fever that you can't control, concern for a broken arm, things like that, you should go to an ER. Now, the significance between an urgent care and an emergency room visit is the cost. So emergency rooms are going to cost you a lot of money, like probably thousands of dollars. So if you think it's something that can be handled at an urgent care, like a UTI, please go there first. You can actually even probably call your primary care doctor office first and just say, hey, I'm having these symptoms. Is this something you can manage over the phone or do a phone consult, or should I go to an urgent care? But cost, big differentiator. All right, so here's your action list. Find your insurance card, figure out your insurance numbers, copay, deductible, out-of-pocket maximum. Remember that phone number on your insurance card, save it in your phone. Schedule a wellness exam if you haven't seen a doctor within a year. And if something is bothering you, instead of Googling it, talk with your doctor. Because you own your own health. And so the first step is just understanding how the system works. I'm Dr. T, and I hope you found this helpful. If there's anything else you want to talk about, if you have follow-up questions, leave it in the comments section, and I'll see you next time.